we live in an alphabet soup world right now. And what I mean by that is we are so, this world of therapy has gotten a little bit out of hand because everybody wants to get their certifications. And those aren't bad things. I mean, they take time. But the problem is, for example, you spend $1,500 to get EMDR certified. Um, you spend thousands of dollars getting certifications in like EMDR or whatever, all these different modalities of therapy. And then they're going to put it on their profile, and you're going to, as a person looking for therapy, you're going to go up and you're going to go on these websites. And they're going to say, I'm Gottman certified, and I'm EMDR certified, and XYZ. And again, those are not bad, but those don't actually tell you how well the therapist works. Those are very different things. We live in a world, unfortunately, where we're chasing certifications more than chasing competence and chasing our craft. We're so busy going to these classes that there's this disconnect in the therapy world, and I think it's kind of ridiculous at this point because now it's becoming kind of a hierarchy, which it kind of sucks because if you're like an EMDR certified therapist, well, guess what? Now you have to take CEUs, continuing education, to keep up with that certification, even though you've already been trained in it, but to be EMDR certified and hold their title, as they promise you, you have a bunch of, you get a lot of street cred to do that, but then you're tied to continuing to get education from them and their certifiers, and unfortunately, you really don't get a lot of room to span out unless you want to do the extra work. So it turns into this money mill. And EMDR is effective. A lot of these other modalities are effective. I'm not fighting the effectiveness of these modalities. I am fighting that there's now this hierarchy where when you're referring in our therapist circles, it's like must be EMDR certified. Actually, that's not your call to make. If a client comes to me, you can recommend that they get certain things, but it's my job as a therapist to first assess and diagnose and look at the situation and see if that type of treatment is warranted or appropriate. But unfortunately, now it's about what, not just the degree you have, not just the kind of license you have, it's whatever alphabet you can add to your signature line and all these certifications. But guess what? To the public, to you guys, those certifications, while they mean that they've been in training, it does not mean that they actually are good therapists. And so instead, as you're looking, somebody may not be certified in any kind of marital therapy except for their license, which allows them to practice, but they may be one of the best marriage therapists out there. And a lot of the masters, the skilled ones, don't have a lot of certifications behind their name. There's a lot of therapists who they've been in the field for 20, 30 years. This was before the big influx of let me get certified in X, Y, and Z. Back then it was a little bit more simpler. And they're usually the ones that are the most skilled and the ones that can handle the most stuff, yet they don't have all that alphabet behind their name because they're not chasing more certifications. They're chasing their craft, their competence, and their skill. That's I think we need to do that. And so please, if you're looking for a therapist, pay more attention to how they make you feel in the chair, not so much what are they certified in.